Dr. Chelsea Sineth. I own the Align Life in downtown Greenville. Has anybody ever heard of Align Life yet? You have? Awesome. Excellent. So we have 6 offices in Greenville. We're a chiropractic and natural health center. So when Robin reached out to me to speak, I was a little hesitant because our specialty is not with children with disabilities or adults with disabilities. But then she said that healthcare can really be something that's kind of set aside for many of these children. There are so many other challenges that take precedence. So what we do really is beneficial for anybody, and it's a largely underutilized service that we can provide to children with disabilities. So in my life, just a little bit about myself. First of all, I'm a Clemson grad. Any Clemson fans? Good. Only a 2? I'm gonna have to go. 3? Okay. But my mom was a teacher. She was a special needs teacher, so my whole life. So I volunteered with children with disabilities all the time. Grew up with them. Had some family members with disabilities. Went to Clemson University knowing I wanted to help people. Ended up at Sherman College because I really found a love for natural health and chiropractic care. So one of my best friends that I met there, who was actually my intern when I was a student there, she had a brother with autism. And we worked a lot with him, and I was very eye-opening experience to the services that we utilize and the benefits that we can use to help children with disabilities. So a little bit about what we do. This is the quote that I'm in love with that really leads me to my passion, that states, "The doctor of the future will give no medicine, but will instruct his patients in the care of the human frame, in diet, and in the cause and prevention of disease." And that's by Thomas Edison. So with Align Life, what we have to offer is, primarily I'm a doctor of chiropractic, and I'm going to really get into that about how that can help any of your clients that you work with. I also do nutrition enhancement. I have a functional medicine practitioner as well as a clinical nutritionist as well. So not the same as a dietitian. We work with dietitians to do family planning, and we'll get into that with meal planning. What we do is a little bit different. So I also do toxin elimination, weight management, and hormone balancing as well. So our mission at Align Life is simply to assist every man, woman, and child to live a higher quality of life. That simple, with the services that we offer. So a couple of quotes before we get into the big topic is, if we do not change our direction, we are likely to end up where we are headed. So if we look at the statistics in the United States, we're a very unhealthy country. Something has to change. And these statistics are even more severe when we look at the disability population. Most diseases begin in the kitchen. In the hand of the physician, nutrition can be the highest and the best remedy. The wise man should consider that health is the greatest of human blessings. Let food be your medicine. So you guys are probably wondering, well, why does this matter and how does this apply to us? Well, when we look at nutrition for anybody, if we're facing challenges, no matter what it is, we can control our diet. We can control the food that we eat. And food doesn't just serve as fuel for the body. It is what creates cells in our body, and it's what allows us to express health to the highest potential. So when we talk about nutrition, what we eat affects our growth, it affects our repair, it affects our digestion, it affects our immunity, which ultimately affects our health. So when I was doing some research, looking at the CDC, we found some statistics that many of you might know, but people with disabilities can find it more difficult to eat healthy, control their weight, be physically active, and this might lead to a list of different things. Lack of healthy food choices, difficulty chewing or swallowing, medications is huge. Those can contribute to weight gain, weight loss, changes in appetite. Physical limitations that can reduce a person's ability to exercise, pain, a lack of energy, a lack of accessible environments, and a lack of resources. Which is excellent that you guys have come together to help provide some of those resources for these people in need. So this statistic really stood out to me. Obesity rates for children with disabilities are 38% higher than for children without disabilities. So when we talk about health, it's not something that we can ignore in this population. We know we have an obesity epidemic in America, but our children with disabilities are at even higher risk for that. So what does that mean for them? One other statistic is when we look at the obesity epidemic, we are spending billions of dollars to combat that. But in the disability population, annual healthcare costs of obesity that are related to disability are estimated at approximately $44 billion. Okay, so there's a huge need to help this population for sure. So what does this mean for these kids? Is overweight and obesity increases the risk of the number of conditions, including heart disease, type 2 diabetes, cancers, high blood pressure, lipid disorders, liver and gallbladder disease, sleep apnea, respiratory problems, osteoarthritis, and then gynecological problems, like young girls having infertility issues or starting their menstrual cycles at much younger ages because of the foods that we eat. So when we look at the disability population, 38% higher rates of obesity. This means that they're more susceptible to these diseases as well. So while they're already facing some challenges, if we don't help get control of their health the best that we can, we're going to see a rise in this as well. Does this make sense to everybody where we're going? Okay. So in my office, what do we recommend? So like I said, I'm not a dietitian. We do functional medicine, we do clinical nutrition, and really it's very simple and it's very specific to the patient's needs. So just like when you write an IEP that's very specific to that child, the plans that we come up with are extremely specific as well. So you can have a child with ADD and ADHD, and we can simply work with removing gluten and food dyes and toxins from their food and see results. You can have somebody on the severe spectrum of autism, and we might need to do a little bit more work. Some of the students children that I've worked with are very picky in their diet. I'm sure you guys have all seen that. One kid that I worked with literally would only eat chicken nuggets. That was it. So it's very tough, but if we can start making some small changes with them, their health will greatly benefit. So what I look at primarily is acidity, allergy, and glycemic index. So if your body's very acidic, you're going to have higher rates of inflammation, higher rates of confusion, and higher rates of diseases in the body, like heart disease and different things. Allergies can affect the body in different ways, and they can be present in different ways for different people. And then glycemic index, which has to do with sugar and insulin levels and how that can affect health as well. So we have this beautiful chart that we put together that we go through with all of our patients, and we talk about the foods in the green are the foods you want to try to incorporate into your diet. The foods in the red are going to be the ones that are going to cause those inflammation and factors in your body. So now, outside of nutrition, my primary focus is chiropractic. So has anybody ever been to a chiropractor before? Okay, many of you. Okay. So with chiropractic, we've really developed a name for ourselves for neck and back pain. And if you've been in a car accident, come see a chiropractor, which is great. We're excellent for that. That's a very small portion of what we do. In my office, I live by another quote. You can tell I love quotes. But Hippocrates stated, "Look well to the spine for the cause of disease." And I'm going to explain why that is. Your nervous system is the most important system in your entire body. We know that because it's the only system entirely encased by bone. You've got the skull that protects the brain, and you've got vertebrae in your spine that protect the spinal cord. The brain sends signals to the body through the spinal cord and then out of these nerves that go to every organ, cell, and tissue in your body. Can you think of anything in your body that's not controlled by the nervous system? It's because there's not. So when we look at this chart, and this is up in my office as well, you've got the brain that signals through the body and all these nerves that come through. In between each vertebra, you have a spacer called the disc that acts as a spacer for the nerve. Those nerves exit, go to every organ, cell, and tissue in your body. So if I were to take this nerve, go into your heart, and I cut it, what's going to happen to your heart? It's going to stop. Now, if I put pressure on that nerve over time, do you think that the heart's going to become healthier or sicker as we age? Sicker, absolutely. So that's a very drastic example, but when we have misalignments of the bones in the body, what we can see is that it puts pressure and it can affect the nerve signals from the brain to the body. And this can present very differently in anybody. What's important about this is a lot of people think of that as a pinched nerve, but you can't always feel it. It's what we call a subluxation. And a subluxation is a misalignment of a bone that puts pressure on a nerve that affects the way the body is functioning. So this is what that subluxation looks like. You can see here we have two bones nicely aligned with the disc space to open up for the nerve to go here to communicate with whatever part of the body that nerve is going to supply. When we have a misalignment, it's going to compress that nerve, choking off the information from the brain to the body. We can then herniate disc and we can get osteoarthritis and things like that as well. So that's what a subluxation is. The weight of a dime can affect the nerve interference by 60%. So that's a little bit of weight, but that's a huge amount of pressure. we actually do not start feeling pain until our nerve is functioning at less than 60%. Because that pain to me is an indicator that there's something else going on. So it's going to affect the nerves and it's going to affect the joints as well. When we go down the spine, wherever those nerves are going to, if we have interference with those nerves, it can affect the body in some way. So it's different for everybody. I've worked with children with ear infections, colic, asthma, I've seen aches and pains go away, I've seen bedwetting, different things as well. But we're going to focus in on the disability population and how I've really helped them through chiropractic care. When you look at a cross-section of a nerve, you have three parts. In the blue, you have 45% of our nerves that control our muscles and how we move. Okay? Misalignments in that area can cause weakness, spasms, fatigue, and tightness, and balance issues as well. In the yellow, we have another 45% of our nerve. If interference in that area, we can have sinus allergies, low energy, digestive problems, breathing problems, because it goes to control our organs, blood vessels, and all of our cells. So that's 90% of the nerve already, leaving only 10%, like I said, to detect pain. So in my office, when we talk about health, it's not based on how well you look or how well you feel, it's on how well your body is functioning. And when we look at a child with disabilities, they're already facing so many challenges that through nutrition and chiropractic care, we can help their body function at a higher level. I am not saying we're ever going to cure any of these challenges they face at all whatsoever, because we're not. But what we can see is we can help prevent some of these chronic diseases from occurring, help prevent some aches and pains that they might deal with, and help improve their overall function of their body. Some different things that can cause these subluxations. All of these pictures are of adults, but you can replace it with anybody, but many of us are sitting at a desk all the time, and many of the kids are working on iPads and tablets. A lot of them use them to communicate. So they're looking down all the time. This can add, whenever you're looking down, just as this person here, it can add up to 42 pounds on your spine. It's the equivalent of walking around with an 8-year-old child on your back all day. Okay? So technology is huge. Technology is utilized a lot in children with disabilities, and it could really put added pressure on their spine. Sleeping positions, car accidents, and sporting accidents as well can cause those misalignments. When kids are learning how to walk, they have over 2,000 falls by the years of age 5. 200 of them are considered serious, meaning they can shift their spine out of alignment. Children with disabilities, depending on what that disability is, could have even more falls than that could really lead to some injuries in their body. So when we look at what a normal healthy spine should look like, there should be 3 curves. One in the neck, one in the mid-back, one in the low back. But the problem is we're losing those curves. And we're losing them at a much younger age now than we used to. And that really, truly affects the way the child is functioning. So I'm going to show you a couple of x-rays, and I'm going to tie this back around to some specific children that I've worked with disabilities. But I need you to understand how to really look at x-rays before they do that. So this is a normal, healthy spine. When I take an x-ray, this is what I would love to see. Still looking for it. Just kidding. But this is where the red line is going to be where that spinal cord sits. Your brainstem is going to be sitting right about through here. Okay? So when we have this normal curve, we've got the least amount of pressure on the nervous system. When a bone misaligns or subluxates, what happens is the rest of the bones move forward to compensate for that, and we move into phase 1 degeneration. So you can see what happened. We completely lost that curve, right? So when this happens, do you think we're going to have more or less pressure on the nervous system? More pressure. Do you think this is going to get better or worse on its own? Worse, absolutely. So this happens over a period of 3 to 5 years. It's not one incident. It's something that happens over repetitive use of looking down all the time, slips, falls, sleeping positions. Stress can cause that as well. So if we don't get this corrected, we then move into phase 2 degeneration, where we actually start to lose our disc spaces. And this creates bone spurs, which is the beginning of that bone fusing into the one below it. And this happens over approximately 10 to 15 years of an uncorrected and undetected subluxation. This is where most of the people who come into my office are. When we move into phase 3, we get permanent fusion of the spine, which is over 20 years of an undetected, uncorrected subluxation. So I'm going through this very quickly, but what I want to show you is, if you look at this spine, would you say this spine is a good spine or bad spine? How's it look?
Not so bad.
It's not too bad, right? curve is decent. I like to see a little bit more. But when we look at Myrna, she's actually 72 years old. She's been under chiropractic care her whole life, so she's never let her spine go uncorrected or undetected of a subluxation. When we look at Chloe, what do we see on Chloe's spine? Perfectly straight. Chloe came to us not for neck pain, not for back pain, but she had ADD and ADHD, was being medicated for that, and she also was throwing up every single time that she ate. So her parents were very worried for her. They were going to take her down a route, try some different medications, and somebody said, I've heard about Align Life, I want you to bring her in, let's get her checked. So when we checked Chloe, we took an x-ray, and this is exactly what we saw. Now for children with ADD and ADHD, when we have this amount of pressure on their spine, it's going to increase the signals to the brain, not allowing them to be able to focus properly. Working with her, we were able to reverse her curve, remove that interference from her spine. She was able to come off of all of her medications, and now she's doing perfectly fine. Yes. So we see this often with children with ADD and ADHD. Now, are they always going to come off their medications? No, but they're going to be able to function a lot better than many other children when we can relieve that nervous system, because they're already dealing with so much on their little bodies.
How old was she?
She's 11 years old. Forgot to click through, but yeah, she was 11 years old.
But is that just kind of random? Is there any reason that she would be aligned like that at that age? I mean, is that, you see that a lot with kids that young?
Yes. And it is, like I was saying earlier, the older generations were more active and didn't have as much technology, but now children are born with basically cell phones in their hands, and they're looking down at tablets all the time. This is actually good compared to what I see. I'm seeing a huge reverse in these curves. Actually, I took an x-ray of a young girl yesterday. I don't always take x-rays on children. It really depends on their history and what's going on. We can really help correct it. Chloe had some traumas going on that we needed to take some x-rays from her. But I've seen reverse curves, so you should have that nice C shape. And most of the kids that I'm seeing now are the complete opposite of that. The Mayo Clinic actually did a study where they showed that with every 10 degrees of forward head posture, you could add extra weight to your body, but you can also, when you have that forward head posture, lose up to 7 years of your life. They did a study that showed not very many people live over the age of 75 when they have that forward head posture as well. But yes, so what I see in kids is when we have this interference in the nervous system, I see a lot of ADD and ADHD. I've worked with children with autism and we've seen relief from some of their symptoms as well. But we never say we cure anything, but our goal is to get them functioning better. But this is extremely common, we call it text neck. So, but this brings me to the end of my presentation, which is a story about Matthew. So when I was in chiropractic school, I wanted to go in to be a pediatric chiropractor. I love children, I love working with them, they respond really well. And some of you might think, oh, why would you ever bring a child to a chiropractor? But the way I adjust them is extremely, extremely gentle, not like the way you would adjust an adult at all. And they love it. But I had some issues growing up as a child that were helped through chiropractic care. I've seen it happen in my office and with other chiropractors that I've worked with as well. So when you're in chiropractic school, you get paired up with an intern and you are their student patient. So when I was an intern, I got paired up with my student patient. Her name was Robin. Robin came to me and she said, I don't want you to work on me, I need you to work on my son. I'm like, yes, I love children, bring them on. So we go in the clinic, she brings her son one day, and her son is Matthew. Matthew comes in, he was 16 years old at the time, about 6'2", very, very, very tall guy, about the size of a pole, okay? I worked with a lot of children with autism through volunteering and then through my mom being a teacher and different organizations as well in Charleston where I'm from. Matthew was one of the most severe cases of autism that I've ever seen. He was nonverbal. He couldn't do any of his daily activities for himself, but he also, on top of that, being as tall as he was and as, having such a severe case of autism, had 8 seizures a day from the time he was 3 years old until up until now. So with Matthew, children with autism are very hypersensitive. So I have to feel the spine, feel the muscles, feel what's going on to figure out the proper adjustment to give him. And he did not like that. I got bit a couple of times, got hit a couple of times, and it was fine. So I learned he liked shoelaces. So I would give him shoelaces and he would just be enthralled in those shoelaces. And that allowed me to be able to feel his spine and find out what was going on. Well, His C1, which is your atlas, which is the first bone in your body, was completely shifted, tucked up under this occiput on that right side, putting a lot of pressure on his brainstem, decreasing the body's ability to function properly. So finally, after a couple of visits, I was able to give Matthew his first adjustment with a tool that I call an activator, which is a very gentle technique. It allows me to adjust them without having to sit down or lay down or anything. So I adjusted Matthew, and he went home, and he did not have a single seizure for 31 days after that. So he had 8 seizures a day, and with one adjustment, he did not have a single seizure. We continued to work with Matthew, and he then started sitting down at the dinner table, not interrupting. He then learned to tie his own shoes, which is huge. So again, I'm telling you, I'm not ever going to cure any of these challenges, disabilities that these children deal with. But what I do know is that we can really increase the way that they are functioning. And I've seen it every day. Matthew's just one case of many that have had relief through chiropractic care and nutrition. So I know it's not the typical route that somebody would go, but it's something that I think is very underutilized. And I believe in it because I've seen it every single day.